Gaza right now is the worst humanitarian crisis that the world is facing.
Dr. Zahir and I have been to many places together. This is by far the worst I've ever seen.
Chicago doctors with a humanitarian group will fly to Gaza tomorrow.
Chicago area doctors are documenting their experience as MedGlobal volunteers in Gaza.
Friday, the doctors head for Gaza, where several health facilities have been leveled or abandoned during the war.
I want to bring in now someone who has been dealing firsthand with the aftermath from the catastrophic explosions. MedGlobal's Lebanon County Director, Dr. Tanya Baban.
The health employees spent a few weeks in Ukraine training medical staff from that country.
Fadi Abed works for the international medical humanitarian organization MedGlobal.
This Dallas-based OBGYN is one of two physicians preparing to depart North Texas for a 2-week medical mission trip into Gaza.
Nurse Brenda Maldonado from Washington State, working in Gaza for the past 2 weeks.
He worked from early in the morning until late at night, volunteering with the international humanitarian and emergency response group MedGlobal.
Joining us now is an American pediatrician who recently returned from volunteering with the humanitarian group MedGlobal.
I've been speaking to Adil Al-Mahi. He's MedGlobal's country director in Sudan, and he himself is one of the nearly 10 million people who've been displaced by this conflict.
We saw Dr. Noreen Ahmed, a critical care specialist from Pennsylvania. She is also the medical director of MedGlobal, a U.S.-based NGO that trains local healthcare workers in disaster and conflict zones.
There are people who are displaced everywhere across the Gaza Strip. And in addition to that, the entire healthcare system is collapsing.
This was the scene at Nasser Hospital in southern Gaza in late January. Doctors and nurses, short on supplies and beds, knelt on the floor as they tried to save bombing victims.
Coinciding with the bomb blasts were mass casualty events that came to the hospital 30 to 45 minutes later.
We have mass casualties coming in waves at a hospital. That's happening at least 3 or 4 times a night.
In one night.
Mm-hmm.
We have patients lying on the ground. Anytime we get mass casualties, which is almost every single day, the patient's brought in and placed directly on the floor.
500 to 700 patients a day, wounds and burns. These were all being cleaned without anesthesia.
There are people getting limbs amputated without any anesthesia. That's what we're seeing on a day-to-day basis.
We're in the process of planning an emergency response to distribute whatever basic needs the displaced population will need, including food kits, hygiene kits, winterization kits.
1 out of 100 children in Gaza has been killed. This is a huge number by any measurement.
The second you start picturing the children that are suffering there, the second you see that they're on the floor in hospital beds, bleeding, that you will start to appreciate the need for this.
Profit MedGlobal is helping with the vaccination efforts. It has dozens of doctors and nurses on the ground.
We're both servicing centers as well as moving community health workers into the community to distribute these things. It's a remarkable team of people, and I couldn't conceivably be more proud of them.
So we've seen people scattered all through the Gaza Strip, looking for clean water, looking for doctors to be able to treat them, and they don't have any sort of reprieve. They're not having a chance.
What we practice here for worst case scenario is their daily life.
10 million people fled their homes and now they are IDPs. Those are directly affected by the conflict.
No one is safe, even in the humanitarian area. It makes you think, why did I take the decision of evacuating in the first place?
And we have to get serious about this, and we have to talk about the suffering people and make sure that we can bring them some sort of reprieve, some sort of recovery. And I think that's a question that's long overdue. It has to be answered now.
It's important for us to maintain the moral leadership in the war, to stop the war, and also to make sure that there's more food and medicine for the people who are suffering. And we can do that.